Good afternoon, everyone, and thank you for being here. I'm joined, as usual, by Dr. Joe Cantor of the Louisiana Department of Health, and he'll go through some slides with you that point out in more detail some of the data that we use to inform our decisions on the proclamation that we will be putting into effect tomorrow. Overall, from a high level, we continue to see several months now of sustained improvement with COVID hospitalizations and an increase in the supply and availability of the vaccine. And by that I mean the doses we are receiving are considerable. We have more enrolled providers than ever around the state to actually administer the vaccine. I think that number is actually over 1,500 now. And I think you're going to see that there are, over the last couple of weeks, from some small increases in the incidence of COVID in Louisiana, which concerns me and should concern all of us, especially when you put it into the context of the variants that are out there. Our baseline numbers, however, continue to be low, and in the grand scheme of things, relatively flat, as you'll see shortly. And we've made decisions in the past on very high baseline numbers as a reason to keep restrictions and mitigation measures in place, even if we had a couple of weeks where the trajectory had been improving. And so with basically flat or small increases with the very low and stable baselines, I've decided that we are going to take some steps in further reducing restrictions and mandatory mitigation measures. Another positive trend is the very steep decline in COVID deaths of people 75 and older, our most vaccinated group. And it's now been more than a month since Louisiana opened up vaccine eligibility to everyone 16 and older, regardless of occupation, regardless of any underlying health condition. We were one of the first states to do that. Today I can report 26% of Louisianans are fully vaccinated, and that includes more than 67% of those who are 65 and older. Now, on the one hand, we're very thankful that that number of people have chosen to be vaccinated. On the other, I can tell you that's not where we need to be, and we're going to have to continue to work hard to increase those numbers. But it is a good start, especially for our older and more vulnerable populations. So taking all this into account, we're going to be making some changes to the proclamation. I signed it a few minutes ago. It goes into effect tomorrow, and it'll be in effect for 28 days. Instead of a blanket mask mandate, we'll be allowing local leaders and business owners to set their own policies regarding masks. And of course, that's not any real change in the law. Private property owners always get to do things like that are more restrictive, and certainly local political leaders have always had the ability to be more restrictive as well. I will tell you that because of a federal mandate, that masks are still going to be required across the state of Louisiana on public transit. It will still be required in many state buildings and at K through 12 schools in consultation with Superintendent Brumley and others in K through 12 education, and colleges and universities, and then all healthcare facilities licensed by LDH, because you certainly have a preponderance or a large number of individuals in those settings who are vulnerable to the disease based on their age and or health condition. And that does include nursing homes, which I think everybody can agree, especially since it was early in the pandemic, 40% of all deaths were happening in nursing homes. But I will tell you, I am very heartened at the improvements that we have made in nursing homes, and I think you're going to see some slides in a little bit from Dr. Cantor that will illustrate that. For state buildings, the mask mandate will stay in place. However, the head of an agency may opt out in writing to the Secretary of the Department of Health and just put a clear sign up at the doors that they have opted out. Now, even if they were to opt out, obviously people have the ability to wear a mask inside that building should they choose to do so, and I would recommend that they do that. All of my cabinet agencies will be keeping mask mandates in their buildings. It was just yesterday that I received a report of a DCFS worker who actually died from COVID, and so we're going to keep the mask mandate in buildings that are controlled by state agencies that work for me. We know that masks work. The evidence is clear. The science is well established now, and we've seen a very positive impact on our state. But at the same time, we've had a mask mandate in place since the middle of July of last year. I think it's now intuitive for people to wear a mask in order to protect themselves in higher risk settings and also to protect others. And you may remember that early on, when masks were first recommended, it was all about protecting others. And then they realized that there's actually a benefit to the wearer of the mask because they achieve some protections from the virus as well. Fortunately, we have a lot more tools for slowing the spread of COVID than we and the controlling the impact of COVID as well than we did even a few months ago. And these include better treatments and, most importantly, several highly safe and effective vaccines. The three, Pfizer, Moderna, and Johnson & Johnson, all of which are available today in Louisiana. And again, anyone 16 and older is eligible to receive a vaccine. And just like other states that have lifted the mask mandates, it's not an end to mask wearing. It's not an end to recommendations that people wear masks, especially if they are vulnerable, if they're unvaccinated, or if they live with people who are vulnerable and unvaccinated. But I think it is a reflection of where we are at this stage of the pandemic. And I saw something the other day, Dr. Canner showed it to me, and I wanted to relate it to the public, all the people of Louisiana, that if it's a rule of thumb to try to determine in a particular situation whether you are relatively safe. And when in doubt, first thing you ask is everyone around me vaccinated, and you may or may not know the answer to that question, and there's a good chance you won't know. So then if you don't know or you're unsure, use the 2 out of 3 rule in order to slow the spread and make sure that you are as safe as you can be. Make sure your activities meets 2 of the 3 following conditions: outdoors, distanced, or masked. And if you're outdoors and you're distanced, you don't need to wear a mask. But if one of those 2 things isn't present, then, and you want to be safe, you need to wear a mask. I also ask all Louisianans to make sure that they are considerate of businesses and other settings where the owners or maybe a corporate policy or whatever will require that that particular business still have a mask mandate in place. I will tell you that I will continue to wear a mask when in public, when I am close to folks and I don't know that they've all been vaccinated and so forth. I think it's the right thing to do for public health. It's also the respectful thing to do. And am I vaccinated? Yes, I am fully vaccinated. But Dr. Canner briefs on breakthrough cases all the time. And there is no guarantee that I or anybody else fully vaccinated won't contract the disease or become contagious. And so especially if I'm around people who are not vaccinated, I will, and in small groups, then I will feel the need to continue to wear a mask. The new proclamation also eases some restrictions on live music, allows some businesses like salons to reopen their waiting rooms and waiting areas, and removes outdoor limitations on crowds. Indoors, event centers, theaters, conference facilities, they will be able to choose between a 75% occupancy capacity, which is more than they've had up to any point this far, while